I'm Laura. I'm the CEO of VMV Hypoallergenics. We're here to save the world's skin with the safest, most proven effective care on the planet. And today I thought I'd share some tips actually for speaking to your dermatologist. So I'm the daughter of a doctor. I grew up around a lot of doctors, and my sister's in med school, just doctorship or doctorhood or being a doctor, the medical profession is very much how I grew up. So all of my aunts and uncles, were in the medical profession or adjacent to it. So I really kind of grew up in that environment. And I realized as I've gotten older that for people who haven't, seeing a doctor can be a really intimidating experience. And certainly there are issues like medical bias against women or people of color or women of color, certainly. So that's a bigger discussion, but sort of as a basic general set of guidelines, I thought I'd share some things that might help you feel less intimidated by your doctor. The first thing I want to share is you really shouldn't feel intimidated by your doctor. At the end of the day, you're putting the care of your health in the hands of an expert who's very, very well trained and probably deserving of that trust. But it is an expert resource that you are approaching to take care of you. So you are totally entitled to ask questions and to, confirm if you're comfortable with this professional, etc. Of course, we always at VMV say, we're all about the goodness and the kindness and whatever. So I wouldn't interrogate someone harshly because I don't think that is a great way to start any relationship. But these are some things that I think most doctors would actually expect you to ask. When you're first meeting a doctor, certainly you can ask, I'd love to learn more about your training and your experience and your specialty. Doctors shouldn't be offended by you wanting to know more about them and their background, right? And their accomplishments. It is expected. And a lot of people like talking about themselves anyway, so it's a good opportunity to do that. The next question I like to ask is, how do you stay up to date? What do you like reading, or are there conventions that you tend to attend? Most doctors are really curious people, and they do have to stay up to date. So they'll probably share, what I tend to read is this, or I tend to attend these conventions. It's fairly normal for doctors to attend the biggest convention in their field, for example. A question I personally like to ask that some of my friends I think cringe at is, do you publish, or do you do research? Do you teach? A doctor who does not do those things is not bad by any stretch of the imagination. But a doctor who does is a cut above. They're the actual contributors to the science, to their field. If you find this question a little too uncomfortable for you, you can Google them. This is the kind of thing that is healthy to Google. To check up on your doctor, type in their name and see like published papers or where they've been quoted, or if they're professors in the residency for that specialty. Another question that I think makes people uncomfortable, and I really think should not, is, if I wanted a second opinion, could you recommend someone for me? No ethical doctor will feel uncomfortable with you seeking out a second opinion, and many will actually refer someone that they look up to, or maybe even trained them, or they heard about, who's a real specialist in what your concern is. Asking for a second opinion just makes sense. It's like shopping online. You're going to compare different vendors, different types of brands of different things. And it's not to be rude. It's not to be like, I don't know, I'm questioning your, I don't even know. I just know it's okay to ask, if I wanted a second opinion, would you be able to refer someone to me? And most doctors I know will be like, yeah, of course, absolutely. In fact, ask so-and-so, please feel free to say that I referred you. It's good. Getting a second opinion, especially for something that's really complex, is a good idea. Asking, are there other options? I think is actually a really good thing. Some doctors will have like a treatment protocol that they're really comfortable with. And if you're not comfortable with it, or if you're curious about another option, I think it's really worth asking. Quoting a random blogger who may not have the best scientific credentials, or some video that you kind of just saw that some friend told you about, without looking at sort of the source, the legitimacy of the source, that can be a little frustrating for sure. But if you say you saw an article in, a reliable news source that quotes a peer-reviewed, published study, and it seems like this might be another treatment option, then your doctor will probably look that up and look into it and see, maybe it's appropriate for you, maybe it's not. But your doctor will make the best recommendation they can for you based on your particular history and what they know about what's currently available and research and all that stuff. They spend, this is their job, this is their career. They spend their time researching and learning about all this stuff. If you're interested in something else, sure, bring it up. But I would really trust the expertise of the professional that you are seeing, right? You're seeing them because they have that expertise. My favorite question that I really encourage everyone to ask, including my kids: I am confused. Could you clarify that for me? And the reason is your doctor, many doctors that we talk to, one of the bigger challenges is patient compliance. They want patients to follow the instructions of a treatment or medication or a lifestyle change. So if you don't understand something, don't be ashamed about asking them to clarify it. They will appreciate that you are being mindful about trying to follow your instructions, their instructions. Again, you know, a lot of it, of course, has to do with tone. If you're going to come in sort of attacking your doctor and being like, I know better than you because whatever, I don't think that's a great way to start any conversation with a doctor or anyone else. But I do think that these are questions that I think sometimes people can feel a little embarrassed about asking, and really you shouldn't. Most doctors really expect these types of questions and actually appreciate them because they know they have a patient who is engaged and listening and wants to know more and is being responsible. So that's it, just some quick tips, some kind of best practices from our experience, certainly mine personally growing up around doctors. Remember, we provide the safest, most proven effective care on the planet by allergen emission, by a clinically published validated hypoallergenic rating system, which is like a grading system to show you how many allergens are not in a formulation that we make. And if there's an allergen, if it's one of, it's clearly identified quickly. So if it's one of your allergens, you know not to use it, and we'll provide you alternatives if you contact us on vmvhypoallergenics.com or even here, anywhere. And we prove our efficacy by publishing our clinical studies. Thanks to my mother, who's our founding dermatopathologist, we have 75 plus clinical studies published in peer-reviewed journals around the world. And yeah, we're big believers in safety and efficacy. And I hope you found that helpful. Please like this video, share it, follow us on Instagram, Facebook, and subscribe to our YouTube channel. And check out vmvhypoallergenics.com for more information about us. Check out our blog, vmvinskin.com, certainly, because we post a lot of helpful tips and vetted content regularly. Take care. I hope you have a skintastic day. Bye.